protect yourself. That is a caution from the public health official bearing COVID-19 patients as reports emerge of more Ghanaian contracting the deadly disease. Frustrated relatives and friends of some persons who were being prepared for burial after reportedly dying from the disease displayed their anger over the handling of the situation on Thursday. One Muslim family, for example, had lost 3 relatives to the disease within the last month, but they say none of the immediate relations or contacts of the deceased have been traced and tested since the deaths. Komla Adom has been following this burial and has more in this report.
Clad in red and black in 2s, 3s and sometimes more, at the 37 Military Hospital morgue Thursday morning, relatives of 3 people reported to have died of COVID complications wept. Accra Metropolitan Assembly officials had gone to collect the bodies for burial to be strictly supervised by environmental health workers.
This is the 5th burial for COVID-19 victims, and burials are strictly supervised and monitored by the Environmental Health Department of the Metropolitan Assembly of Accra. We're burying 5 bodies at a go. This is a set of 4 bodies, 3 bodies from here, 37 Military Hospital here. We move it to the Awudome Cemetery to give them a befitting burial there. From there, we're going for another body at the Rich Hospital. That is 2 bodies there, and do the same to them.
2 other bodies from the Greater Accra Regional Hospital will add to the initial 3 to make it 5 bodies to be buried Thursday. But after the first 3 were laid to rest at the Infectious Diseases Cemetery at Awudome, it will be a struggle to get the other 2. Angry relatives at the Rage Hospital will not allow the AMA officials and our crew to get close. They accuse health officials of not properly handling their relatives. 3 of their relatives have died from COVID in separate instances, but none of the close contacts has been tested. It's been almost 40 days since our mother died. They say she died of COVID, yet nobody has been to her home. Nobody has traced to find out where she lives. None of us has been tested. They also contest their relatives died of a disease. One of our relatives, for example, had been sick for 2 years, yet they say she died of COVID. On top of that, all the hospitals we have been to have taken monies from us for preservation and burial. We cannot understand. This is not fair. The family alleges in all 3 instances, hospital officials demanded monies from them for preserving and burial of their dead. Meanwhile, the Public Health Directorate of the Accra Metropolitan Assembly is warning it may be handicapped in burying the dead if they are not provided the needed equipment and materials.
The challenges we have is enormous. These bodies, they are infectious bodies, which we don't have to use the public haste in transporting the bodies to this infectious zone. We have made appeal to the state, the government, to support us with a movable and befitting double cabin pickups that we can always carry these bodies safely to the burial site. You can see that the movement through where we will bring the bodies to is a serious challenge. There is no adequate space for movement. Coming into the place is difficult. And the haze has to stop at the end of the entrance. The officers have to carry this body. Imagine how heavy it is. With these 3 stumps, there's the possibility and high risk of infection to the officers. And therefore, if we have a good transport system that this body is placed in and it moves closer to the grave space, we will have easy way of removing the body and placing it safely.
How about even some of the officials who were in the buckets? I mean, this all adds to the whole transport system.
Risk. You can see that when we were transporting the bodies from the mortuary, because of inadequate transport facility for the department to be able to adequately, transport the officers safely to the burial site, you see that they were all hanged in the bucket. Very serious risk, and even poses a serious stigma to the public, because you see the traffic we were moving through, which is not allowed, that the public should see that this is the regalia. We are going with the COVID out, though it tells the public to know that the COVID is there, that we need to be safe with the officers who are responsible for the burial. We are appealing, with all apologies, we are appealing whoever is responsible to support the Metro Public Health of AMA, the Environmental Health Department, Metro Public Health Department, with a movable truck, quick equipment, double cabin pickup, very special, which we can easily transport these bodies here. We do disinfection, we do the burial, which we have no any form of equipment to transport and carry all these duties as we are here today. We have to improvise the means of bringing the bodies here. We have to improvise the means of laying the bodies to rest. We are appealing to government. We are ready. We are called to duty. We are called to carry out our mandate, but we need to be resourced.
Thank you. You heard the very passionate Inspector Setanga there. I mean, these people are giving off their all, you know, for the good of the country, for God and country, and all they say that they need to be adequately resourced to be able to carry out this particular mandate that they have given up themselves to in help or Mother Ghana as we battle this COVID-19. So you can see some wreaths also laid there. In a short time, the family members will come, lay the wreaths on the tombs, and then pay their final respects to their departed.